I started the morning with food. I end the day with food, and everything in between was food.
I just felt really doomed because my family has a history of obesity.
What I wanted to do in life did not include being heavy.
Among the patients who come in who are successful is a desire to change their lives.
And to make changes in their life to take them to some place where they have never been before.
Many other methods are perhaps successful at losing the weight, but I feel like we give our patients hope that they can maintain that weight loss.
But if somebody were to ask me, if you had to do this over, would you do it? And my answer has to be in a heartbeat, because now I have a heartbeat.
What the lap band can do for people that they really can't do for themselves is whenever you diets inevitably fail because I get hungry. And somewhere along the way, hunger almost always wins out over willpower.
I would go in and eat something and say, this is enough, and then a few minutes later thinking, but boy, it's sure like some of that.
This isn't some cure or some fad thing to just do of, hey, I need to lose a few pounds. This is somebody that's significantly overweight, at least 80 to 100 pounds over their ideal body weight.
I just looked at it like I only have like 10 more years to live at 306 pounds.
What the lap band does is two things. It takes away the hunger. It absolutely takes away the physical hunger. Really, really controls it. And the other thing that it does is it makes it impossible for you to overeat.
I would put food on my plate, but then I would go back for seconds, and then I would go back for thirds.
The stomach is tricked, if you will, in putting this pressure on the wall of the stomach, so it sends feedback to the brain that, oh, we're getting close here, and you're happy on only a small volume of food instead of having to fill up the whole stomach to feel satisfied.
It's not hugely invasive surgery. It's done laparoscopically. Probably 95 or even higher percent, maybe 98% of our patients have this done as an outpatient. They don't spend overnight in the hospital.
But I started walking the same day I had surgery. Didn't walk very far, but the same day I had surgery, it was early that morning. By that evening, I was up and I was just moving around in the house, and I haven't stopped since then.
5 small incisions are made. 3 of them are pencil-sized incisions and 2 finger-sized incisions through the abdomen, where the top part of the stomach is isolated. And a little tunnel is placed around the stomach where this band that can be buckled around the stomach, just like a belt, can be put on. It's connected to a little tube that extends out to a reservoir that's underneath the skin but outside the abdomen, and can be accessed by a needle in the office to adjust the diameter to help them feel satisfied on varying amounts of food.
And so that's one of the great things about the lap band is that we can change it after surgery. It's not just something that once surgery's done, it's done, and there's no way to change it. With a lap band, I can change my degree of adjustment, how tight the band is, for a variety of different patient goals and a variety of different patient needs.
In fact, some of my patients will go back to some other diets that they had tried before that worked in the short term, and now they work better in the long term because they're not hungry, because they're satisfied on less.
Well, average weight loss at about 18 months is about 40% of extra weight. So lap band patients lose weight a little more slowly than, let's say, a gastric bypass patient would, but their weight loss goes on over a longer period of time. In order to have the lap band work, it's more than just having an operation. The lap band has to have good support.
Psychological counseling and dietitian evaluation, and make sure people understand how and what it is that they need to do to make this work are key components in being prepared to then make those changes in their life to be successful.
That's one of the things I think if we had any genius, any stroke of insight as we started our lap band practice, it was a realization that it was more than just being a good surgeon. It was more than giving them a great operation. We had to provide that support for them as well. And I think that's where we have been able to really make a difference.
You know, it isn't a cure-all for everybody that it is a tool, that it is something that you still have to work at. You still have to change your eating habits and you have to exercise. And I was willing to do that.
We recognized right off the bat that this was going to take more than just nurses and doctors.
They are here for me. They want to make sure that I succeed.
And if that meant hiring a dietitian and a social worker and an exercise person besides the RNs and the doctors, that's what we did.
We don't just put a lap band in a patient and then say good luck. We support them for several years. As long as they need that support, we teach them, we encourage them. We try to do everything we can to help them find a new lifestyle that works for them.
There's going to be some hard times. There's going to be times when you feel down. There's going to be times when you hit a plateau and you think, how can I get off of this? And we can help you. We can give you the tools that will help you to get through those hard times and those things when you get discouraged, because they will pop up on the journey. They will.
Many of the nurses and the people who participated had been through the surgery themselves, and that was kind of a plus for me. I thought, okay.
That if they know that I know what they're feeling, and that I got through it, and that I overcame some of those feelings and bad habits, that there's hope for them.
We touch on a lot of different subjects. We do have problems sometimes with family members who become jealous, that you've lost weight, or or friends, that are jealous as well, So we help them to figure out how to deal with those kinds of things.
They need to learn to cope with the new person that's coming out. For a lot of people, it's very, very easy, but for other people, it's hard.
But there have been a few patients which kind of go into a depression after they lose the weight, because either the journey's over with or they have to reinvent themselves. They have to say, I used to be, the jolly, fat person or whatever, and now I'm, thin, and so, I've got to figure out who I am.
And those things, people, if you're going to run a lap band program, you really very, very quickly realize that you're not just doing operations, that you're really changing people's lives, and you have to be able to provide for them the resources that they need as those changes are made.
I think our support group is something like a net. And if you don't have that net underneath you, you might get into trouble. The more support, the better. And that was a big factor in my making the decision to go with South Valley Surgical, was the support system that they had in place.
I'm 56 years old. Nothing's going to change that, but I'm a healthy 56.
Well, yesterday when I hit my 100-pound goal, and went up and talked to him, and he just don't give me a handshake. He's like, you got to give me a hug too, and so, he does care.
The thing about Dr. Aldridge and Dr. Hansen is they get it. They understand. They recognize what you're going through, even though neither one of them have ever been obese.
We're excited to see them improve their lives. It's exciting to have anybody improve their life and their health, and there's a great reward in that, and the lap band helps accomplish that.
They are the most caring surgeons I've ever experienced. They decided to do lap band surgeries because they wanted to help people change their lives. Because as surgeons, they saw obesity and all of the effects that it has on people. They wanted to help, and they felt like this was the way to do it.
Just as a reminder, and a lot of people sacrifice to make this happen, and this serves as a reminder.
I had about 7 bags of clothes that I gave away, and kept these around just to say, never want to go back to this again.
And I could never have begun to even remotely imagine the rewards that one gets in doing this kind of surgery.